Hello, everyone, and welcome back to Housing Liaison Onboarding Training. Today, we will be doing Module 5 on safety practices. I'm Sherry Downing with Advocates for Human Potential, and I'm here with my colleague, Ann Denton, who will begin to lead us through this module.
Thank you, Sherry. And we're glad to have the opportunity to talk to you about this. This is really an important topic. There is a dynamic tension between the work that you're doing on behalf of people and with people and being able to be safe while you're doing that work. And so this module really covers some significant practical information about how to be safe and feel safe in these environments, and also do the tremendously important tendency supports that need to happen for people to be successful. At the end of this module, we believe that you'll be able to describe and then incorporate into your daily practice safety measures during home visits, outreach, and during transporting clients. So one of the things that your context is that in a permanent supportive housing or housing first program, you are out in the community. You are working all kinds of hours. Many programs have people working evening hours because that's when people frequently need support. And that anything can happen. You can be out there and there could be a crisis in an apartment complex. There could be a psychiatric crisis that the person is experiencing. You never know. Safety should be a basic component in everything that you do. You should set up your approach to site visits, to outreach, to transporting clients, to any interactions out in the community with a basis around how are you going to be safe. And then when you have done that, that will give you the flexibility and the freedom to do the work that needs to be done, because you will be able to feel safer. So I like this slide. One of the things that will help you is that your agency has a set of policies and procedures that are going to govern what you should and shouldn't do out in the community and in home visits. So you should know what those agency policies and procedures are. For example, later on in this session, we're going to talk a little bit about transporting clients. Your agency, some agencies allow you to transport people in your own vehicle. Some agencies prohibit that. And so knowing what your policies and procedures are is important information for you to have. The other thing that I think for me, when I was doing this kind of work, the basic training around how to conduct myself is the first step in feeling safe. And so what you have with you is you have a functioning phone that's charged. You have your car keys. I keep my car keys in my pocket, not my purse, and your driver's license. I think for the work that you are doing, casual clothing is going to be best. No need for a 3-piece suit and a tie, gentlemen. Knowing where you're going and making sure that somebody else knows where you're going also. For teams that have like a morning meeting, that's a great time to share what your schedule is for the day. If you're not in that kind of a team situation, making sure that it's part of your routine to let people know where you're going to be and when during the day. Paying attention to your surroundings. When you take a safety training, any kind of safety training, one of the first things they teach you is to look, right? Look at what's going on around you. Listen, right? Listen for cues. Pay attention. Just pay attention. One of the main things to pay attention to is body language. We all do that anyway. It's not really something that we have to learn to do, but I think it's important to learn to interpret the cues that you get from body language. So facial expressions, whether or not the person's looking you in the eye. And it's important for me, I have to control my own interaction with the person I'm trying to help. Am I making eye contact with them? Or am I composing a grocery list in my head and I'm not really paying attention? Right? And then eye movements, am I nervous? Is the person nervous? These are things that we pay attention to. One of the important things to keep in mind is personal space, right? So how most people have a well-defined comfort zone to how close people can get to them. And I think it's important to go into any interaction giving people plenty of space, right?
And I think this kind of goes to the last slide, but I think it's important. I think we can squeeze it in here as well. I think one of the things that it's important to remember, particularly if you're out in an encampment, if you're in an area where someone has been sleeping and living and eating and conducting all their personal affairs, it's really important to make sure that you're wearing closed-toed shoes. Even if it's a warm day, you really don't want to be wearing sandals because you just don't know what kind of germs are out there, if there are needles, if there are other things that can be dangerous to you. The other thing, and I learned this from an outreach provider many years ago, early on when I was first doing outreach in this capacity. And what she said was, I'm just going to tell you this once, but before we go up there, so we were going under a bridge where people had been living for a long time. It was interesting because they had pulled mattresses up on the little ledge under the little cement ledge under the bridge, and they had their pictures up there. And I know that we've talked about, you're visiting people's homes. There was a huge hillside that was all pretty, dusty dirt, just dirt. And she said, do not touch your face until we get back and you can wash your hands, because some of the germs, and she said, people are using it for a bathroom. They might be throwing their, litter from their substance of choice around. She said, do not touch your face, particularly do not touch your eyes until we get back and you can really wash, because those germs are really transmittable and they're dangerous. And she was the most wonderful outreach worker I've ever had the honor of working with. But that was a good tip. So I always make a point of passing it on when we're talking about safety.
Oh, and I think it's an excellent tip. I mean, the whole approach here that we're trying to convey is paying attention to your environment and doing exactly what Sherry said. Being aware that there are risks out there, and at the same time having self-awareness of how you're conducting your own self, your body language, your tone, the way that you're interacting with people. It can be taught, right? It's not that some people can do it and some people can't, but it takes practice and it takes knowledge. And I think that the tip that Sherry just shared is really important. It's you are entering someone else's home. You don't know the risks. And respect and paying attention are going to be keys to being successful. Just to sort of sum up the strategies around how you conduct yourself and what to look for in the environment is always, respect personal space, and you are visiting them. And then just calm, right? From our perspective, I'm here to do a job. Part of that job means I'm engaging you in a relationship. I'm engaging the person in a relationship. And I am not threatening, right? I am not trying to make people do things that they don't want to do. And the number one rule, I think, is if you don't feel safe, leave. You don't need to come up with an excuse, right? You don't have to make something up. You can say, I'm sorry, I need to leave now, and go. right, Sherry? Go.
Absolutely. Trust your gut. And then this is another one, and it's, it's one that nobody ever talks about because it's sort of hard and embarrassing. But the reality is, some of these folks have been living rough out, they've been trying to survive without homes for a while. There's no place to shower. There's no place to get in and really rub. Nobody's going to be wearing cologne. And some of the smell, sometimes people get really stinky. It is so important to control your facial expressions and your body language because, you don't want to hurt people's feelings. It isn't their fault, and it isn't even the way they would necessarily be if they were indoors. It is really about the circumstances that attend homelessness. But I do think it's important to be aware of that. Masks can be really useful, but masks can also be triggers. I know at least one outreach worker who takes a little jar of,
Hand
gosh,
sanitizer?
that's it. No. I'm thinking of I want to say the little cream that you do for colds that has the really menthol smell to it. That
Mhm.
our mothers Vicks used to rub on our chest.
Yeah.
And she just puts a little bit of it under her nose before she'll go into an encampment. That isn't a safety protocol, but the reality is it can help you be better able to be available without being, without making somebody uncomfortable.
Yeah. That's a great example. And that's a great practical tip. What we're trying to do here is give you some practical tips. We've talked about kind of your basic demeanor, and we want to talk about the dynamic tension between safety and getting your job done in 3 different situations for the remainder of this training module. The first one is about home visits. Then we're going to talk about doing outreach. And then we're going to talk about when you're transporting people. So meeting individuals in their own home, one of the things that is so important to remember, one, is they are allowing you to visit them in their own space. And the other thing to remember is this is not a social visit. This is a quote from Sam Sambaris's book about Housing First. The home visit is the heart and soul of the work we do. And, this is a caseworker saying, ultimately, this is where you want the change to happen. You are bringing to people the opportunity to change. The home visit is an opportunity for you to model the correct behavior about how you visit and how you do social interaction. It's also, and we're going to talk about this in a little bit too, but it's also it's a clinical, deliberate, intentional interaction between you, who are the expert in how to help people, and the person who may or may not want your help that day. This slide talks about services and supports that are acceptable and effective for the tenants served. And we talked in a previous module about services and supports are voluntary in Housing First and permanent supportive housing programs. Sherry, do you want to add anything to that before I move on?
I think when people get into their homes, and it may be the first home that they've had for a long time, and we've talked a little bit about, treating people respectfully, even if they're still surviving without a home. But once they get into homes, they begin to gather possessions and they begin to display their possessions, and they're one of the things that I have found over and over and over again in people's brand new Housing First homes across the country is that they are so excited to show you. There was one woman, I think you were with me on that site visit, Anna, maybe it was Arizona or someplace, but we went to visit a woman in her home, and she had, it was tidy and clean, and she puts little pictures and things up on the wall. Well, she loved makeup, this woman, and she had gathered this plethora of makeup, lipsticks, nail polishes, blushes, Do you remember that? And she had the little plastic containers and they were color coded. Man, she was on it, in terms of organizing them. That was such a gift for her to give us because she was allowing us to see something that was important to her.
Mhm.
What I want to stress about that is if you're going into someone's home and they're showing you something, like I think we told this story in an earlier session about the guy with this tiger art on the wall. That was important to him. The makeup collection was important to this woman. What they've done is offer you an opportunity to connect at a whole different level, maybe than you have before. It's an opening, and it's really important. This is a therapeutic device. This is an important part of your work in Housing First. And that is a way that you can begin to add depth to the relationship.
Yeah.
I suggest when you leave, when you're doing your case notes, I really suggest if you've learned something about somebody, their puppy died last week and the puppy's name was Bernard. You want to, loves makeup, has color coding. You want little clues so you can go back before you go next time and remember what they told you, because you may be seeing tons of people, right? And so you want to be able to go back and say, ooh, have you gotten any new colors? I do love those colors. It doesn't matter, whatever. There's a way to connect, and that shows respect, and it shows that you have really been listening to what they've been telling you, which can help you, give them the tools to move themselves to the next level.
Yeah, absolutely. Absolutely. Sherry's really talking about making it personal on that level, making the engagement and the relationship real with that person. And because we said it in a previous training, and we'll say it again here, people recover through relationships. They use the services and supports we give them, but one of the most important indicators of recovery, one of the important predictors of recovery in the scientific research is that people have a relationship with someone, a caring relationship with someone. This slide talks about how you do your job in terms of background, in terms of knowing the person. And this is really related to what Sherry just said. To note what you notice about people, what's remarkable about people, what you can have a conversation about someone with the next time. Also, you have access to, and it's your job to know their clinical history, to know their housing history, to know a little bit about where they've had difficulties before, all of which you should have gathered during the housing search. But if you didn't help the person find housing and you inherited this person from somebody else's caseload, still, it's your job to go back and know all of that. If you're uncertain, right, you check in with people before and after you go on a visit. If you're uncertain, bring somebody with you. I mean, assuming that the tenant will give you permission to do that. And again, if you have the great benefit of working on a team, that is a great way. You can bring another team member with you, and then you go with them on one of their visits. It's a good way to maximize your impact. Again, back to Sam Sambaris. We talked about him in a previous recording here, but I love this quote: warmth, respect, and compassion lie at the heart of all communication between staff and clients. Remember, when you're planning a home visit, you're a guest in their home. And remember, when you're planning a home visit, this is an intentional clinical event, right? It's not a social visit. One of there are really two areas to be paying attention to when you're doing a home visit. One is anything that's related to the housing, and I'll talk about that in a second. The other is sort of clinical and personal things that are going on with that individual. And so on the housing related stuff, we're really talking about, you're in their home, paying attention to the surroundings, noting things. So does the ceiling light not work? Is the faucet dripping? Is the toilet running, right? is there anything missing? Right, so you get in, you've got somebody in there and they've got, a bed with no pillows, let's say, right? That kind of detail will allow you to have a conversation with them about something that's practical and something that they probably really could use some help with. The other thing in sort of the housing section of what you're doing with a home visit is sort of testing the waters, asking the questions about how's it going with the landlord, what, who are your neighbors, how's it going with neighbors? What is, you want to know about their experience in the housing, and you want to be alert to things that could cause trouble. The other thing here that it talks about is how's the tenant doing with routines? And I think that refers to, how are they doing around their daily living activities?
Absolutely. I think where I really pay attention with the routine piece is to see if somebody is moving along and doing the kinds of things they like to do and engaging with the people they like to engage with, and things, I can tell that things are going well. If, my friend Joe is going to the library, or Sue is going to her AA meetings on a routine basis, or they are grocery shopping, whatever it is. I mean, and you'll be helping with some of these things. But if suddenly you see that the sort of activity, the routines fall away, you see the activity decline and people become more insular and insulated from others, that can be a real red flag. And it may be a sign that you need to sort of step up the intervention. Mm-hmm. Conversely, if somebody is, usually pretty much of a homebody and they don't go out a whole bunch and they, they're a little shy, and suddenly they're just engaged in a huge flurry of activities and have offered to run, the big fundraiser for one of the agents. I mean, whatever, it doesn't matter. But if you see real changes in routines, that can be a red flag, and you just need to be aware. And this comes back to building the relationship. You may not know that this is out of routine for somebody if you haven't built that relationship. They might go, well, I'm off to a ladies auxiliary meeting. We're planning a 3, and you say, really, Sue? Wow, that's a big change for you. Do you want to talk about that? Mm-hmm. So that's what I would do with routines. I think how's it going with the neighbors? The neighbors can be a real weather vane for how things are going with the person in the unit. Mm-hmm. So if you go outside with your client and you're taking a walk around the block, or you're just going to, buy groceries or whatever it is you're going to do with the client, and the neighbors are going by you with their eyes averted and they're walking faster, could something be going on?
Yeah.
So it's just, these aren't just how's it going with the neighbors. It isn't just how it's going with the landlord or is the person keeping their routine. These are all things that you can watch from a sort of clinical perspective, from a housing liaison, housing first perspective, to make sure that the person, is going to be sustainable in their housing.
Yeah. Yep. Absolutely. Yes, absolutely. And so again, I'm back to, in my mind, based on what Sherry just said, we're back to paying attention, and we're back to being intentional in what you're doing. However, there are limits to the home visit. So I can talk to people about what things that are related to tenancy, and I can talk to people about things that they've asked for help with. And that's going to cover 95.5% of everything that you need to talk to people about. So Sherry, let me ask you a question. I'm your social worker. I'm your housing liaison.
And you're here again.
Yes.
You're here again.
Yes.
What can I do for you today, Anne?
Well, today I'm going to walk right over to your refrigerator and open it up and see if you've got any beer in there. And then I'm going to turn around and go to your dryer and make sure you're emptying the lint.
Really? Does
Should I
that
do
seem-
that?
No, that may seem like a bit of a stretch. I
It's-
don't know if we told this story before, but there really was. We were doing a site visit somewhere, and there really was a social worker that we ended up, I think she ended up becoming a bank teller or something instead. But she was walking into her clients' homes and opening the refrigerator and pouring out alcohol if she found it.
Yeah, yeah.
I mean, that's such an overstep, and it's beyond your scope. Sometimes people fail. Sometimes people make mistakes. And sometimes people just want a cold beer in the evening. And some people can do that and some people can't. But it is not your job. It is not your job to mediate whether they can. You can't have that beer.
Right.
No, that's not your job. Your job is to give what you can, what you've been asked for, and keep promoting successful tenancy.
Right. For me, we talked about this in the last module on harm reduction. It's, have I been invited into the conversation, to the topic?
Oh, good point.
So if I'm coming into Sherry's apartment and I'm sort of officiously walking around and looking in her refrigerator and checking her dryer and, and doing the, shaking my disapproving finger over her head, that is not going to work, and it is outside your scope. However, if Sherry knows I'm coming and I knock on the door and she greets me at the door, and I will come into the house and there's, marijuana
Mm-hmm.
and alcohol sitting out on the coffee table, right? For
Right.
me, that means she's willing for me to at least ask the question. She's put it in my face to the point where, I will take that as an opening and ask her those questions. How's it going? What's this about? It's 2:00 in the afternoon. Tell me about this. Right. And there's a slide a little bit further where we're talking about clinical issues that really talks about, when is that really a red flag? And it's a red flag for Sherry, hypothetically, because there's substance use problems in her history, which because you have looked up Sherry's file before you go out there. It's a delicate balance, and it's not easy work to do, but we're hoping that this conversation about how to do a site visit, a home visit, will be helpful. And again, right now we're talking about, let's look for things that are housing related. And in a minute, we're going to talk about, let's look for things that are more clinical or personal. Well, actually, we're talking about all of it right here, but clutter is housing related, right? It's clinical, but it's also housing related. Because clutter can be a lease violation.
And,
Yeah.
I would just say, some of us are better housekeepers than others, and that's okay.
Yeah.
When things have gotten out of hand to the point where I'm going to betray my age here. There was a book back when I was a young person that I loved, and it was called My Brother's Keeper. And it was about a man who had burrowed in and he was a hoarder, and he had gathered so much stuff. It was brothers, actually. He had gathered so much stuff that there were tiny paths through huge stacks of newspapers and junk mail. And there was no place clean to fix a meal, or even to really, there was a little tiny space around the beds where they could get in to sleep. There was a little tiny space into the bathroom in the kitchen where they could get in. But this had really taken over. Most of you aren't going to see clutter to that degree, but you will see hoarding, because people have been without stuff for, maybe for a long time. And then all of a sudden they're starting to see, people just leave furniture on the sidewalks. You could just take it.
Yeah.
It can become a problem really quickly. And it will, as Ann said, put your housing at risk. I think all four of these things are really talking about how how they affect housing, how they affect somebody's ability to sustain themselves in housing.
Mhm.
I'm thinking Anne will probably talk about this for a minute, but relationships can be a huge problem if somebody has been living without a home, but with a community for a while, and they get in and their friends haven't gotten in yet. It can be a huge temptation to just say, well, you can sleep on my floor for a little bit.
Mhm.
But why is that a problem, man?
Well, I mean, that's a problem because it threatens your tenancy.
Right.
Yes, right? If you have people staying who are not on the lease and they're staying for a long time, that's a lease violation. The other thing is those friends could get you in trouble, right? So they could be using illegal drugs, and even if you're not, you're responsible. Again, illegal behavior is a lease violation. And on a clinical level, if I have substance use problems in my past and I'm trying to stay sober, my friends are coming over and using drugs or alcohol, it's a tenancy issue, it's also a clinical issue. So Sherry's gonna walk you through, there are a couple of situations that we wanted to talk about just because these are so common. And we previewed friends who overstay. When we have gone around the country, one of the most common things that we hear from people who are doing home visits and from people who are helping individuals transition from unhoused to housed is the problem with friends. Mary.
Absolutely. I think it's human to want to help people that you care about, right? So if I'm housed, if I've gotten into housing and my friend has not, and it's cold outside, or it is, there's all kind of problems with being, houseless and trying to survive. And so you say, well, come on, Ann, you can stay with me for a little bit while you find a place. But finding a place isn't easy. We all know that. First of all, there's a housing shortage everywhere in the country. And second of all, people who are unhoused often have histories that can make it really difficult for them to access housing without help, without, say, a Housing First project helping them along. But when they come over and then they overstay. So, a night probably is fine. A couple nights is fine.
Yep.
If you're going to have somebody there for a week, I would be telling the landlord. But the reality is maybe once they get in, you can't get them back out, or maybe you don't even want them to go. But this is a problem because you are the one on the lease, and that is a lease violation that can absolutely end up meaning that you're evicted. I mean, you can lose your housing over this, and that's the worst. And some of the reasons are listed about why people may say, oh, come on, and you can just stay for a while. And a while can, a day can build into 2 days to a week to a month, and then pretty soon you're looking at lease violation. It's really important that tenants, you can have anybody over that you want to, and you can have friends in for a dinner party, you can have them in for a cup of coffee, you can have them in, you can have them come and stay for the night. But you really need to make sure that you manage these relationships in a way that doesn't threaten your tenancy. And that's the bottom line to me is, do you have anything more about that?
I don't, but the next slide is really good because it really talks about what can I, as the housing liaison, do in that kind of a situation. And I love the fourth bullet. To the extent possible, be supportive and judgmental, asking what's your goal here, or how can I help, rather than what are you thinking? I mean, if there's anything that sums up the proper approach, that's it.
I love that. So, and you also, this is an important piece. People who have serious mental health issues, people who have co-occurring substance use disorders, people who do not have long histories of healthy relationships can be at risk of being taken advantage of. And predators sense that, and they can move in on somebody in a way that's really not healthy. And so what you want to be doing too is if suddenly I've got, Gilbert staying with Anne, and he's been staying a while, and he's there every time I drop over. And I watch, and Gilbert, there are people pulling into the driveway every 20 minutes, and Gilbert goes out to say hello to them. That can be, that can be a real red flag. The reality is you want to pay attention to those relationships and assess, are they voluntary? Is the tenant at risk? Is the tenant being coerced in some way? Is this tenant able to say no? So that's what I would, and talk about this with your supervisor and your team. This, they may have different perspectives, especially if some of them have worked directly with this person.
Again, I mean, I think you are going to have, everything is based on the relationship that you and this person are able to craft together, right? And so, but one of the things that Sherry and I have talked about before, and that is relevant here, is you need to be able to ask the hard questions. And that's extremely relevant in substance use.
Absolutely. So substance use, here we are. When the tenant or their visitors are using substances, it might be fine. But sometimes you might just want to talk about it. So how can you tell? First of all, does the person have a diagnosis? You've got access to that information, and you kind of keep that in your back pocket. You don't go, well, Sam, I read in your file that you have had a long-standing problem with alcohol. No, but you do keep that information in your back pocket, and you factor that into what you're seeing. And has the person shared with you any stories about trouble they've had because of substance use? I mean, did they say, I really like my beer, but gosh, I hate it when I fall asleep on the curb and I'm there the next morning because people step over you and it's just embarrassing. I'm really a little bit, not really a lot facetious, but a tiny bit facetious. Has a person shared stories that, that illustrate that substance use has been a problem? Has the substance use resulted in a lease violation? If those answers are yes, be curious, be non-judgmental, ask if they have concerns about what's going on. Okay, well, I know you've told me a couple stories that, that were worrisome to you, that made you feel uncomfortable. Are you worrying now? Are you feeling uncomfortable about what's happening now? If there have been disruptions to neighbors, has there been damage? Or, what is your responsibility if you got really angry and put your fists through the sheetrock? I mean, how do we assess, and then how do we help? And we just, one of the things we can do is talk about your responsibility. We can talk about treatment or self-help and make referrals if people are willing to take the next step. So if any of those answers are no, then stay out of it. It's not your problem, not your business, right?
I would just add one thing. I mean, this slide talks about substance use in general, and alcohol use is legal. Other substances are not legal, right? And so the use of illegal substances, while it might be clinically not an issue, right? So the person doesn't have a history, it's not a problem, right? But the use of an illegal substance is a lease violation.
Absolutely. Yep.
So
what do you do if one of these, if these answers are yes, and what do you do? Well, I think one of the best things you can do is talk this over with your supervisor or your team. I think that is going to be a really valuable resource for you. And that is another relationship you need to really build, because this can absolutely check your perceptions. And in a different phase of our lives, used to be my supervisor. And I can remember her stepping in at one point and saying to me, are you having trouble? And I'm like, nope, everything's under control. Of course, I'm at a stage with my work at that point where it's like careening down a mountain on a bicycle, thinking you're in control, right, of that bicycle. And you're going faster and faster. And, and it's obvious that you're going to wreck. But her perception of that me on the bicycle was really helpful, because then it gave me an opportunity to take a deep breath, take a step back and say, yeah, I might need some help.
Yes.
Right. So that supervisor can be, and your team can be absolutely wonderful resources for you and have your back, in the best situations, they're going to have your back. And if you've got valid concerns about somebody, this is back to the trust your gut comment, visit in pairs. I always recommend doing that anyway. I might see something that Anne doesn't, and vice versa.
Mhm.
It can be a really useful device.
Mhm.
And Anne said this, we'll say it again. We'll probably say it again in the next training. If you're uncomfortable at any point, leave. You can always go back later.
Mhm. You can always go back later. Yes, I think, yeah. To sum up about home visits, you're doing a couple of different things. You're paying attention, you got your radar out, you have your expert cap on, right? You are there to do an intentional clinical intervention, or it's a clinical interlude, right? It's a clinical event. And that you're looking for things that threaten the tenancy, and you're looking for things that are personal or clinical concern for that individual. And that's what you're doing in a home visit. You're doing some of the same stuff in street outreach, but I'm gonna let Sherry talk about that.
Well, as you all know, I love street outreach. I think I've been pretty clear about that. People that I've met during street outreach have been some of the most generous people I've ever known. They share their stories. They'll willingly share they'll willingly share. That said, it's really easy to become a little overconfident and think I got this.
Yeah.
I love street outreach. I am fine. I am just fine. Nobody is going to hurt me. And the reality is you need to use your spidey senses and make sure, you're kind of aware of what's going on around you. If it is sort of a dicey area, even if you feel like you've got all the skills you need to navigate that area, it's still important to observe some of the basics. If it really is a dangerous area, and we all know there are dangerous areas in just about every community, don't go after dark.
Yeah.
Really don't go after dark. Go with a friend or, a colleague. Leave if you feel unsafe. Let people know where you're going, right? Now, I was walking, oh gosh, it was pre-COVID, but pretty much immediately pre-COVID. And I was in Los Angeles for a conference and got the great and wonderful opportunity to visit Skid Row and Skid Row Housing Trust. Yeah. And I was with one of my colleagues whose spidey senses are probably a little sharper than mine. And she was like, did you see, how people were zeroed in on you? And I was following and I could see that. And I'm like, oh, I can't, that doesn't seem accurate to me. But, it may have been her, her spidey senses were maybe a little better than mine. The reality is you need to be aware that you are not superwoman, and people experiencing homelessness as a rule are at way greater risk from us than we are from them. Mm-hmm. That said, people can end up in periods of such desperation in their life that they're going to do what they need to survive. And that might be taking your purse or your, or whatever. I mean, the reality is you cannot anticipate every single thing that could happen. And that's why it's great to think about having somebody with you, making sure that people know where you're going, wearing appropriate clothing, making sure you have supplies and backup. I also think it's really useful if you're doing street outreach to have stuff to give away. That might just be water bottles or candy bars or socks. Big one. That's a huge one, right? Mm-hmm. Pay attention to your surroundings. Be aware. Avoid carrying things that can make you, an object of attention if people need money or valuables. And, unless you really know the area or the people living there, somebody who's willing to act as a as a guide, avoid places like alleys or tents, and certainly don't open the tent flap and poke your head in, and that's a violation. But I was not so long ago, actually, I was in a place where we were doing some street outreach, and there was a woman living in a tent on the street, this little tent. And she comes out and she was just absolutely distraught. And she was completely decompensated. So she would be furiously angry one minute and crying and dejected the next minute and then laughing. She was very decompensated. And she said, and I have an owie. And that's how she said it. I mean, it's almost very childlike. And she said, but I have an owie. And she said, come in here. I want to show you because it's in a private place. No, you're not going to go in that tent to look at her owie. It is not. Now, what the actual outreach worker, because I was just there to observe, but what the actual outreach worker said was, I will take you to the doctor.
Yeah.
I will be glad to take you to the clinic or the urgent care. But and you can always fall back on protocols and rules. I'm not allowed to go into your tent. But, I'm just saying that. And there may be cases where you feel like it's safe enough and it's okay enough and you know the person well enough that you decide to trust your gut. But, I would say in general, that might not be something that you want to pursue. Avoid places where there is a ton of illegal activity in progress. And don't step in if somebody's trading a packet of white stuff for some money. You really don't want to get in the middle of that. Don't take gifts. Do not take gifts. Do not lend your own money. Now I'll say that one is a little less hard and fast because, I've got an outreach worker I know who's got a fishbowl on her desk and it's filled with things clients have given her.
Yeah.
Some marbles and there's some pens and there's some, little hand carvings out of tree knots, whatever, but they're not valuable and they came from someone's heart. And it's like, somebody brings me a pretty rock, I'm going to keep the pretty rock. I mean, I just recently took them all off my bookshelves, but that's way different than something of monetary, greater monetary value. Don't lend money. But both of these, and it isn't just about the money, it really is changing the level of the relationship in a way that can be destructive to the clinical practice.
Yep. Ooh, that's it. That sums it up. You are there, same as from a home visit. You are there as an intentional event. You are there to observe, you're there to assist, you're there to engage, but you're not there to be anybody's friend.
That sums it up. Absolutely right. You
Yeah.
want to be there. You want to share your stories. You want to share to the extent that you are helping the person move to the next level. But you're certainly not going to go, when I was, 10, my mother was so mean to me. That is, unless the person is really distraught about something that happened to him, and you're going to use that beginning to say, but I figured out that.
Right.
You just absolutely need to be guarded. And that's really all about boundaries. And it's all about ethics. You just really need to make sure that what you're offering is designed and intended to help the person, not to take anything back that will feed, something you need. It's not about you, I guess, would be a better way to put that.
That sums it up.
Yeah. Well, we'll move to this next one. This is the first approach. I think you all probably know this. We've probably covered it all. Start with your name. I'm Sherry Downing. I am here to see if there's anything I can do to help. Be respectful, be natural, be non-threatening. Beware of of overstepping in terms of people's space. I love the offering something tangible. I think that's really fun. Food banks are often willing to give you the bag of apples or the case of water to take out on your, on outreach. Tell how you can help. Don't overpromise. You
Amen.
absolutely do not want to promise something that you cannot deliver. And transporting.
So one of the things that we already talked about is your agency is going to have a set of guidelines or rules for you about who can transport and when and how. And so it's your job to know that. If you are transporting people in an agency vehicle or your own, there are some things you need to do. Make sure people are wearing a seatbelt. If you are in your own vehicle, you have invited them into your personal space. So that doesn't mean you can smoke cigarettes and chew gum and eat a Burger King while they're sitting there. And it's not appropriate for you to take someone somewhere, even if they have an appointment, if they're intoxicated or they're sick or they're they seem agitated and threatening. You're under no obligation to take them if you don't feel safe. And we're back to that spidey sense that Sherry talked about. And the other thing is you take the person where you are supposed to take them. So if you're going to a doctor's appointment and the person wants to add a run to Walmart, that wasn't in the plan, right? It wasn't in the plan. So we don't do that. It doesn't mean we won't take people to Walmart, right? It's just you have told your team where you're going, then that's where you need to go.
And I would say it's your vehicle or it's your agency's vehicle. It doesn't matter, but you are absolutely well within your rights to say, I'm sorry, you can't smoke in my vehicle.
Oh, absolutely. Yeah.
It's absolutely within your rights to say, you must wear your seatbelt. It's my agency's policy. I'm sorry you don't like seatbelts, but you must buckle up for safety. Also, this provides you, first of all, two things. This provides you two opportunities. One, I have never known an environment that is more conducive to open conversation than in a vehicle where you're both staring ahead of you at the road. Right? It's
Yes.
When my kids, that was a great device when my kids were, particularly when they were teenagers, it was like, yeah, get in the car because I know that we would be able to have a good conversation. And the other really nice opportunity is that you can model the behavior you wish to see. So if you're a smoker, it might mean refraining from smoking, or, if you are hungry and you have a bag of cookies in the car, share the cookies. I mean, it's just common respect, modeling good behavior.
Yeah, I agree. And so I think, you may have noticed that in all three situations that we've discussed, the home visit, the outreach, and the transporting people, that the same themes have come up again and again. The first one, respect, right? The second one is trust your gut. If you don't feel safe, leave. You don't owe anybody an explanation. You get up and go. And then, problem solve that with your own team, with your supervisor. And even, the next time you visit this person, you can problem solve it with them. That, I believe, sums up what we needed to talk to you about in terms of safety. We hope that we've given you some practical tips about how to feel safe and how to be safe, and also how to use your clinical skills and your observational skills to help people. And we have finished Module 5.
We will be coming back to you with Module 6, Landlord Engagement, and that is a really fun one as well. I think if I had to sum up a theme for this work, this whole body of work, it is the most rewarding work in the world to watch this relationship grow, and then to watch someone grow because of that is hugely, hugely affirming. And you're making a difference every single day. So we are excited to come back in a little bit and talk to you about landlord engagement. And thank you for joining us.